Ich hatte Ende Oktober 2011
End of October 2011, I had a severe accident while motorcycling.
im Krankenhaus nach verschiedenen Untersuchungen auch.
At the hospital, I underwent CT and MRI imaging, which revealed that there might be a tumor in my brain.
Gehirntumor bei mir drin ist.
In a CT scan, the doctors found that there were some irregularities in his brain. That's why he received a MRI. We looked at the pictures and saw a T2 hyperintense lesion, which was most likely a low-grade glioma.
When you receive the diagnosis of having a tumor at the beginning, you will be very disappointed, and you will have to cope with this message.
We performed surgery in our new IMRI unit with the support of ultrasound and intraoperative monitoring. After we thought that we have resected the tumor entirely, we covered the patient in sterile sheets and performed the intraoperative MR scan. After performing the scan, we evaluated the images, and what we found is that there was some residual tumor left in the frontal part of the resection cavity.
VISIUS surgical theater is giving us several advantages. So one of these is the possibility of performing high-resolution image of the pathology, and at the same time to perform functional studies of the brain with a high-field magnet. A second very important advantage is that the magnet is moving to the patient and not the patient to the magnet.
We know that the intraoperative MR technology enables us to improve the precision of the procedures, especially if tumors are located adjacent to sensitive areas or critical structures, which could potentially have a negative impact on speech or motoric capabilities. From my point of view, IMRI makes a lot of sense, because during surgery, an intraoperative image had been taken showing some residual tumor, which was then resected as well. This was positive for me.
After the patient woke up, he had a slight hemiparesis on the left side of his body. On the first post-op day, we performed our routine MRI scan, and there we could see that we have removed the entire tumor. Also, we saw that we did not injure any relevant anatomic structures, so we felt good and could say to the patient that the neurological deficits he suffered from the surgery would recover within days or weeks. The removal of the entire tumor would probably not have been possible without IMRI.
Ich fühle mich wieder fit, ich habe mich gut erholt. Die Operation ist jetzt 4 Monate her.
I feel well again, and I've entirely recuperated. Surgery dates back 4 months now. I'm starting to get back into shape.
Also die Form zu erreichen, wie ich es letztes Jahr gehabt habe. Also meine Zukunftsaussicht ist jetzt von
My future perspective to me looks quite well, since I have a good prognosis regarding the tumor I had. Also, I'm a positive thinking human being. I want to get back to the physical level I was at before the incident. I want to continue with my sport and my professional life, and last but not least, take care of my family.
Currently, we have started a study group in Germany in order to perform a national study on intraop MRI. And we hope very much that we can now get statistical data which will show us that the use of intraop MRI with this technology here is really producing a lot of benefits for the patients. And we look forward to continue this development, and I hope very much that in very short time this will become a routine technology in the majority of the large centers of neurosurgery worldwide.